Hello friends, my name is Cecil Zuhaib and my today's topic of presentation is osteoporosis. I will discuss today the drugs affecting osteoporosis. Bone is a mineralized connective tissue that exhibits four types of cells: osteoblasts, bone lining cells, osteocytes, and osteoclasts. Bone exerts important functions in the body such as locomotion, support and protection of soft tissues, calcium and phosphate storage, and harboring of bone marrow. Bones are mostly made of protein collagen, which forms a soft framework. A mineral, calcium phosphate, hardens this framework, giving it strength. More than 99% of our body calcium is held in our bones and teeth. Osteoporosis is a health condition that weakens bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a fall or sudden impact causes a bone break. The most important injuries in the people are broken wrists, broken hips, broken spinal bones. However, breaks can happen in other bones, such as in arms or pelvis. Sometimes a cuff or sneeze can cause a broken rib or a partial collapse of the one of the bones of the spine. Osteoporosis is not usually painful until a break is broken. But broken bones in the spines are a common cause of long-term pain. Although a broken bone is often a first sign of osteoporosis, some other people and the older people develop the characteristic stop posture. It happens when a bone in the spine have broken, making it difficult to support the weight of the body. Losing bone is a normal part of aging, but some people lose bone much faster than normal. This can lead to osteoporosis and an increased risk of broken bones. Women also lose bones rapidly in the first few years after the menopause. Women are more at the risk of osteoporosis than men, particularly if a menopause begins early, for example in 45 years, or they have had their ovaries removed. However, osteoporosis can also affect men, younger women and the children. Many other factors can also increase the risk of developing osteoporosis, including taking high doses of steroids, other medical conditions such as inflammatory conditions, hormones-related conditions, or the malabsorption problems. A family history of osteoporosis, particularly a hip fracture, a long-term use of certain medicines that can affect bone strength or hormone levels such as anti-estrogen tablets, and many women take after breast cancers. Having had an eating disorders such as anorexia or bulimia nervosa, or in some patients it is also common because of having a low body mass index. Many diseases and disorders have been associated with osteoporosis. For example, the underlying mechanism influencing the bone metabolism is straightforward, whereas for others the causes are multiple or unknown. Hypogonadal stress that causes secondary osteoporosis, women estrogen deficiency, men testosterone deficiency, endocrine disorders that can increase bone loss including Cushing syndrome, hyperparathyroidism, hyperthyroidism, hypothyroidism, diabetes mellitus type 1 and type 2, malnutrition, parental nutrition, and malabsorptions. People with rheumatic disorders such as rheumatoid arthritis or spondylosis, the systematic lupus, polyarticular juvenile idiopathic arthritis, chronic kidney disease can lead to the renal osteodystrophy. Osteoporosis can be easily diagnosed on the special types of X-rays known as DEXA scale. This machine determines BMD, bone mineral density. Bone densitometry uses a very small dose of radiations to produce pictures of the inside of the bone to measure bone density and bone mass. Now I will discuss some classes of drugs that are used in osteoporosis. First one is biphosphates. Second one is monoclonal antibodies medications. Third one is hormone related therapy. Fourth one is parathyroid hormone. Fifth is calcitonin. And the sixth one is calcium and vitamin D supplements. In phosphates, we have three kinds of medicines: first generation, second generation, and third generation. First generation is metronate, clotronate, atridronate, and telrodonate. Second generation is aldrinate, contains nitrogen group in the side chain, 10 to 100 times more potent than the first generation. The third generation contains risodronate, zolidronate, contains a nitrogen atom within the heterocyclic ring and are made up of 10,000 times more powerful than the potent first generation agents. Monoclonal antibody medications are also used for the treatment of osteoporosis. Osteoporosis at high risks for the fractions, treatment to increase the bone mass in men with osteoporosis, treatment of osteoporosis, treatment of bone loss in the men receiving androgens deprivation therapy for the prostate cancer, treatment for the bone loss in women receiving adjuvant aromatase inhibitory therapy for the breast cancer. Injections are also used in monoclonal antibody medications. One other method for the treatment of osteoporosis is estrogen replacement therapy. In estrogen replacement therapy, the mechanism of action of raloxifene occurs through binding of estrogen receptors. This binding results in activation of estrogenergic pathways, for example, estrogen agonist effects, and the blockage estrogen antagonistic effects in the tissues that express the estrogen receptors. Most commonly documented adverse effects of raloxifene are hot flushes, flu-like symptoms, muscle spasms, arthralgia. Less common effects are insomnia, vomiting, sinusitis, deep venous thrombosis. The recommended doses for the estrogen replacement therapy are recommended for 60 mg orally each day. Another method which is very important for the treatment of osteoporosis is testosterone replacement therapy. In some studies, osteoporosis men undergoing TRT have been shown to increase bone density through BMD, does not reach the normal adult male levels. Testosterone and its androgen metabolic dihydrotestosterone exerts biological effects directly through the binding to the androgen receptors and indirectly through our aromatization of the testosterone to estradiol, which contains active action through binding to the estrogen receptors. Irritation, redness, pain, tenderness, swelling are the symptoms of its side effects. Stinging or swelling of the lips, unpleasant or bitter taste in the mouth, difficulty tasting fooding, and headache, acne, and breast pain or breast enlargement. These are the side effects of testosterone replacement therapy. Another important medication for the treatment of osteoporosis is Forteo. Forteo is a prescription medicine which is used for the treatment of the post-menopausal women who have osteoporosis and at high risk of having broken bones and cannot use other osteoporotic treatments. Each cartridge, pre-assembled into the delivery device, delivers 20 mg of the teriparatide per dose each day for up to 28 days. Common side effects of Forteo includes nausea, joint acne, and the pain. Teriparatide is manufactured using a strain of Escherichia coli modified by recombinant DNA. Teriparatide recombinant DNA parathyroid hormone is a potent anabolic agent used in the treatment of osteoporosis. An example of Forteo is abaloparatide, which has the brand name of Tymlos. It is delivered and it has 30 daily doses of 80 milligrams. Calcitonin salmon nasal solutions are also used for the treatment of osteoporosis. Calcitonin is a hormone that is produced in the humus by the perifollicular cells of the thyroid gland. Calcitonin is involved in helping to regulate the levels of calcium and phosphate in the blood, opposing the action of the parathyroid hormone. This means that it acts to reduce calcium level in the blood. However, the importance of this role in the human is unclear, as patients who have very low or very high levels of calcitonin show no adverse effects. Calcitonin nasal spray is used together with the calcium and vitamin D to treat bone loss in the woman with the post-menopausal osteoporosis who has been post-menopause for last 5 years. For post-menopausal osteoporosis, 200 international units or one spray into one nostril per day is prescribed. Calcium D3 nicotinamide 4 regulates calcium and phosphorus metabolism in the body. Decreased reabsorption and increased bone density, filling the lack of calcium and vitamin D3 in the body is required for mineralized teeth. One pill 2 times a day for the treatment of osteoporosis is prescribed. Calcium is involved in the regulation of nerve conditions, muscle contractions, and is component of blood coagulatory system. Vitamin D3 increases calcium absorption in the intestines. The use of calcium and vitamin D3 prevents the increase in the production of parathyroid hormone PTH, which is a stimulator of increased bone reabsorption, leaching calcium from the bones. Now I will discuss about prescribing a medicine to a patient. First of all, we will write the name of the patient, then we will write the address of the patient. And in the prescription, first we will write the medicine name in the RP, then DTT, and then we will write the signature in which we will write the number of medicines or number of tablets given to the patient. That was all from my side. Thank you for watching.